Hey, all right, this video is for if you are experiencing a stiff neck, maybe experiencing some pain with movements such as looking or rotating. The pain is more in the back of your neck and into the top of the shoulder blade area. And it feels more stiff and tight. Could be some pain, but nothing, where we're experiencing any sort of tingling or numbness. That is not something that you necessarily want to stretch out. That is something that you want to get assessed and get treated appropriately. If you are new to kind of neck movements, your neck always can move very freely, okay? Most of the time, unless you're in a lot of pain. So with a lot of movement comes compromise of its stability, right? So when we have the muscles locking up, sometimes we have to think to ourselves, okay, is maybe my vertebrae, are they maybe not in alignment? If so, again, go seek out the appropriate treatment for that. All right. But otherwise, if you do generally feel like your neck is a bit stiff on a daily basis, then we want to start with our simple ranges of our neck. And that is looking down. So I am not doing this, right? I am tucking my chin down. Tucking my chin towards the ceiling. Bringing it back to center. Bringing it to my ear. Bringing it to my other ear. Okay? And then rotating. And then rotating. So those are the ranges that our neck should be able to do freely. If you are having problems with that, there's a very simple kind of solution that I want you to try. Let's say we are experiencing pain on our left side. So what we're going to do, if you are seated, you are going to sit on your left hand. Sit on it. That stabilizes the shoulder so it doesn't go up like that, okay? You're going to bring your head towards your right ear. But you notice how I'm not doing this or I'm doing this, okay? I am just bending my head and I have to do a bit of a chin adjustment. This is as far as I can go. We all have neck problems. Okay, so you shouldn't experience any pain throughout this. If you're experiencing pain, you need to back off. It might even look like this, which is fine, okay? You're gonna grab your hand, you're gonna put your hand on your head, and what you're gonna do is you are going to try to bring your ear towards your shoulder while you're breathing and shouldn't cause any pain. If you can use 100% of your strength, do that. If it causes pain, only use about 20%. If you are able to use 100% of your strength, you're going to go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. See if your neck can go a little bit further. Then you're going to do it again. Now, if you're only able to do 20%, you're still going to count to 10. It might take you a little bit longer, which is fine, because we still want to feel no pain while we are doing this. So we're going to do it again. 1, 2, okay, count to 10. Relax your neck. Stretch it a bit further. So what we are doing is we are contracting the muscle tissue and we are fatiguing it. So instead of just stretching it, we're working with the muscle fibers to contract and relax. You can do this, the golden number is kind of 3 to 4 times. And then you can stretch your neck out. So then let's say, okay, we've done it. This is the 3rd time. Now what I would like to do is I'm just going to gently stretch my neck. And I'm going to hold that for 30 seconds, a minimum of 30 seconds. Why 30 seconds? Is because it's been scientifically proven that for 30 seconds, or after the 30-second mark, the muscle spindle cells that hold the muscle in place actually open up and relax. So there's a science to it, okay? All right, so that's this side. Now, You're like, Gwen, yeah, but I didn't get it quite yet because I'm still feeling pain throughout here and that really hurts. No problem. Step number 2, we are going to sit on our left hand. We are going to turn our chin towards our right shoulder and we are going to look down. Now that is going to stretch, as you can see, this part of my neck, okay? Specifically levator scapula if you're interested in anatomy. The exact same concept. You're going to grab your head, bring it down like so, right? And push your head back into your hand, right? Again, 10 seconds, relax. Do it again. 10 seconds, relax. 10 seconds and relax. And then stretch it out, all right? So you can do this. I would suggest doing it on both sides so that you don't feel lopsided. Your neck starts to get stiff on one side. Now, you can also do this if you're still feeling a bit like, that didn't quite get it. Doing some rotations, getting some movement in. You might have to stretch out your chest, okay? Because if our necks are tight and we are in this kind of a position, right? As you can see, I've really brought my shoulder forward. We also need to stretch out our chest to open up our shoulders so that they can relax back like this, right? Make sure your chin is tucked in, your neck is elongated in the back, how it should be. Now, if anything else, if that still feels tight, you've done all of those things, you might have to also do a little bit of a self-massage in your jaw, right? Starting on your cheekbones here, pulling down, massaging into here, because these areas are all connected and usually are quite problematic together. So hopefully that helps. If you have any further questions, let me know, and good luck. Bye-bye.